Hi everyone, I'm Gretchen Bailey and I am here with Ahmad Fahmy, who is the founder of Twin Cities OSD Symposium. And this year it is joining forces with Dry Eye Boot Camp. That's Damon Durker's meeting. And Dr. Fahmy is going to talk a bit about his class, Where Do I Start? So thanks so much for taking the time to talk with me today.
Of course. Thank you so much for having me, Gretchen.
Sure.
So the thought behind my course, the where do I start? Really, it's a question that I get frequently, from our colleagues about different, cases and different, just kind of the methodology of approaching, ocular surface disease. Oftentimes we get behind the slit lamp and there's so much going on that you can just kind of clinically think to yourself, where do I start with this patient? So what I really thought to do is to try to condense many years of really having a clinic where most of the patients that I see are ocular surface disease and dry eye patients, and try to condense that into what are the most pertinent things that I could give as little humble pieces of advice to my colleagues. And so what I did was I kind of looked through a lot of my own patients' charts, and those, there's always, all my colleagues and all providers would kind of know that there are a bunch of, over the years we've collected a whole bunch of these cases that we thought things were going to probably head in one direction, and they might not have, and then kind of reevaluate what was our thinking, or kind of how our thought process, and how we can refine that. And so what I tried to do is sit down and kind of examine my own approach to general approach to ocular surface disease, and what are the most pertinent things that we need to be, that I've learned over the years, as far as how to accurately gather all the data that is needed to take care of ocular surface disease and dry eye patients. What are the most important things that have been most productive at the slit lamp, or kind of examining patients, and then what the third piece of what are some of the treatments that I found to be very effective, and how did I, the methodology bit behind, pairing up the treatment with the appropriate patient.
Sure.
And then after that, being, careful to, fine tune and refine that treatment depending on where you are at the, after, starting the process. And so it's a talk that really is really jam-packed with a lot of information in it. And a lot of our attendees, I want to say that, if there are any, I love having conversations after meetings and presentations. If there are questions, or just want to talk things over, I'm happy to do that. But that was the general thought behind what I wanted to do with that 30-minute lecture.
Wow, that's a lot to put into 30 minutes.
Yeah.
You could pull out a few pearls or pieces of clinical wisdom to offer to your colleagues. What would those be?
I think one of the best things is to, as a provider, if you are really, have a very, if you put in a lot of time into understanding your own process and your own understanding of ocular surface disease, it really helps with how you're able to articulate your game plan to the patient. So I found that early in my career, I feel like, clinically, I have got this. I've got this case. I know exactly what's going on. I know exactly how to treat it. But what I found, that there are some key words that are very important as far as making sure that you and your patient are on the same page. One thing I would like to, highlight is that it makes sense for us to talk about ocular surface disease in terms of, comparing that to the dental model, as far as the chronic nature of it and the importance of addressing it in clinic as well as at home with patients. So being able to really hit that point with your patients, I think, is really critical. The second part of it is, I think that if I had, very limited amount of time, I would say that really careful and very careful approach to examining the lid margin and all of the different maladies of the lid margin and different types of inflammation that can be contributing to the malfunction of the eyelids and the lacrimal functional unit is really, really important for getting to not just the multifactorial nature of the condition, but also the poor etiologies of these conditions of ocular surface disease. So those are the two main things I would say really should be sort of take-home messages.
That's really great information to share. Thank you so much for taking the time to talk with me about that today.
Of course, anytime.